National spike in the number of COVID infections is now causing more hospitalizations and deaths in the U.S. right now, more now than we had at this time last year. Here to answer your questions about that and so much more, Dr. Shira Doron, who is the hospital epidemiologist at Tufts Medical Center. Hi, doctor. Thanks for being with us.
Great to see you, Dr. Doron. Let's start there. Let's talk about the other big difference from last year. Last year, everyone was unvaccinated. This year, it's different. But we now have safe and effective vaccines. So why isn't the U.S. doing better?
You know, the Delta variant is so contagious that it changes the calculation for how much immunity you need to keep cases at bay. And in some parts of our country, they just didn't vaccinate enough. So cases rose, and those translated into hospitalizations and deaths, the vast majority of those being in the unvaccinated. But here in the Northeast, we're so much better off, and that's because we are highly vaccinated.
Doctor, I know a lot of people have been asking this question. How do you know that the COVID vaccines are still providing protection? And people are asking the question because cases keep going up. So is it possible that the vaccines are losing their effectiveness faster than we thought?
Okay, so what we're seeing is that the Delta variant, which is essentially all that's circulating right now, is better at evading vaccines than previous strains. And it also appears that the longer it's been since your last shot, the more susceptible you are. But the overwhelming majority of those breakthrough infections are asymptomatic or mild. So while you're 5 times more likely to get infected if you're unvaccinated than if you're vaccinated, you're 29 times more likely to get hospitalized if you're unvaccinated than vaccinated.
Interesting.
Massachusetts is one of the highest vaccination rates in the country. So any story about breakthrough infections among people who are fully vaccinated gets a lot of attention. So what can you tell us about the risk right now?
Well, in terms of the overall risk, 0.01% of vaccinated people have been hospitalized. Now, the risk right now is definitely higher than it was in June, but the numbers are still way lower than they were in the winter and spring. And now we have vaccination protecting us from severe disease.
Doctor, when you look at the state's COVID data to see who's getting vaccinated and who isn't, which age group is worrying you the most?
Well, the good news is we've given at least one dose to 99% of people over 65, which is amazing. But the younger age groups, especially under 30, are less well vaccinated. And although they're less likely to get severe disease, when numbers are high, we see more of them in the hospital. So I'd like to see a larger proportion of the 20 to 29-year-olds getting vaccinated because they're currently sitting at 71%.
Dr. Doron, thank you so much for your time.
Thank you, doctor.